The imperative now is to quickly adjust our healthcare protocols. And that is a very, very urgent task because we are no longer dealing with 50, 100 cases a day, but multiple times of that. The old ways do not work anymore. So what number of infections are we potentially dealing with? Based on the experiences of other countries, mainly in Europe, which are also highly vaccinated, a transmission wave, we know, does not last forever. It typically takes, if you're lucky, 4 weeks, if not 8 weeks. So 30, 40 days, we can assume that, to peak before it comes down and then stabilize. So during that rise of 4 to 8 weeks, daily cases can double every 10 days. And I think we've been seeing that, which means be prepared for 4 to 5 doubling cycles. So we are 18 days into the wave, as I mentioned earlier, starting 23rd of August, and it has doubled twice, and it's on its way to the third doubling cycle, which is why we saw 100 on 23rd of August, and 3rd September, it became 200, and then it crosses 400, and now it is in the process of doubling from 400 to 800. And beyond that, if we think about in terms of 5 doubling cycles, there's 2 more to go, meaning daily cases may double, then from 800 to 1,006, and then 1,006 to 3,002, hitting a peak before starting to come down and stabilize. So what I have just said is what is possible, having observed what happens in other countries. How it actually unfolds will, of course, depend on what we do collectively, whether we will test extensively with the help of employers, reduce our interactions where possible, wear our mask properly and diligently, get ourselves tested when required, isolate ourselves when we are ill or when we are tested positive through ART. And if we can do that, maybe we can avoid 5 doubling cycles. Maybe we can get away with 3, 4 before we settle down. Let me just cite what are the numbers in other countries having settled down and then living life quite normally. Yeah. I just came back from Europe from a G20 meeting. I can see many European countries are living life quite normally. So if you look at South Korea, life is quite normal there. If we look at the infection rate, and here let's measure it by number of infections per 100,000 population per day. Yeah, so it's a rate comparable across different geographies. South Korea is about 3 to 4 and living life quite normally. Italy, Denmark, Sweden, 9 to 10. 9 to 10 infections per 100,000 population per day. Germany is about 11. Netherlands about 15. France is about 18. Switzerland is at 30. USA is at 45. UK is 55 or so. We are currently 7. So at the lower end of all these countries that have been living with COVID, but rising, and it may surpass many, peak before it comes down. But that is how other countries have dealt with it, going through a wave in order to live with COVID.